Oh my goodness, you are okay.
He's so dramatic.
You are okay. You can't be dramatic. We're taking a video. He's gonna have any extractions today. I think it's just gonna be a routine cleaning. So right now I am placing an intravenous catheter for Deuce's dental. And Deuce was pre-medicated, so what that means is he was given medications to help keep him calm and make the process a more pleasant experience for him. Pre-medications also decrease the amount of anesthetics that we have to give, therefore making it safer. The pre-meds most of the time have some pain control as well. Okay, so the next step is what we call inducing anesthesia. So we've got our IV catheter placed. We confirmed that it is in place and it's patent. So we don't want the anesthetics to go out underneath the skin or subcutaneously. We've calculated his anesthetics based upon his pre-surgical exam and any lab work findings that we have done. Having an IV catheter is important because we want to constantly have access to giving medications and fluids. If we don't place an IV catheter and an emergency situation occurs or we have blood pressure issues, we don't really have a great way to control that. So our standard is to always place an IV catheter, and we do give fluids during anesthesia to help them metabolize medications and to help them maintain blood pressure. So that's the endotracheal tube, and we place it to a measurement based upon the length of the dog because we want it to be placed in the appropriate spot. The endotracheal tube enables us to give the patient oxygen and isoflurane, which is an anesthetic gas that helps keep them under anesthesia. Other monitoring things that we have on Deuce right now are our SpO2 clip. It's right down here on his tongue. This SpO2 clip monitors the oxygen saturation of blood. We see that right here on this screen. It should always be at 95 or higher, so he's right where we want him. This clip also is another way that we monitor heart rate, and you can see that the heart rate is pretty dang close to what he is on the monitor. Other things that we monitor are temperature. So there's a temperature probe that goes rectally, and that is this corner of the screen. So we're monitoring his body temperature. If their body temperature gets low, it slows down their metabolism, and that makes it to where it's a little bit harder for them to wake up, and it's just unpleasant to wake up cold too. The other thing that we monitor, and it's actually taking a reading right now, is blood pressure. So just like in humans, we have a blood pressure cuff that goes on the animal's leg, and it squeezes, and based upon the pressure reading that the machine gets, we get a blood pressure reading. So it's taking a blood pressure right now. We monitor blood pressure during anesthesia to make sure that the patient isn't what we call too light or not under anesthesia enough where they might be feeling some discomfort, or to make sure the patient isn't what we call too deep or too heavy under anesthesia where we need to back anesthesia off. So all of these are safety precautions that we take in place for dentals. Another one that we don't do on dentals just because the equipment can't get wet is called end-tidal CO2. So on dental radiographs, what I'm looking for is the integrity of the tooth roots and the crown. So as we're going through and taking dental x-rays, I'm evaluating and deciding if those teeth are healthy.
Without taking dental radiographs, we aren't able to visualize the whole tooth and get an idea of what is going on with the whole tooth. If you did a dental without taking radiographs and there was a tooth that needed to be removed, but you didn't know about it because there weren't radiographs taken, the pet still may have some pain going home.
This radiograph is a good example as to why we take dental radiographs. So he was missing a tooth in this area, and there's nothing that we can see. And we can take a look at his gums here in a second. But on the x-rays, you can see that the tooth was broken off at some point, and there's actually 2 roots from the tooth left. So today we'll have to go in and get those roots taken out to make sure that that's not a cause of pain and discomfort or infection for him.
So right now I am checking for any furcation, so that would be gingival recession. Could be an indication that the tooth would need to be extracted depending on how severe it is.
So right here you can see where the tooth broke off. You can see where his gums are a little bit irritated. So what we'll need to do is we'll actually need to make an incision and go down and get those retained roots out. Different ways of doing dental extractions, but the best way for the animals is kind of like in people, where we make an incision, we get to the tooth, we extract it, or drill out any remaining pieces if we have to, and then we sew it closed. That way they don't have a gaping hole left there, just like when people get their wisdom teeth taken out.
So after we're done scaling, we go in with the polisher, and this will kind of smooth out all those little micro etchings we did with the scaler. This will help prevent calculus from building up as fast next time. So Deuce has been extubated. Towards the end of his dental, we turned his ISO gas off, and he was just on oxygen for about 5 minutes, and then we disconnect him from the oxygen and let him breathe room air through his ET tube. After he's awake enough to be able to swallow and has his swallowing reflex back, we'll go ahead and pull the tube, and then he's recovering nicely now. Sometimes they can have a little bit of dysphoric recoveries, but we minimize that as much as possible just by keeping them calm.